You're listening to Autumn on the Air, the weekly podcast that brings you conversations about the impact of research commercialization and the people who make it happen. Join us for interviews with patent and licensing professionals, innovators, entrepreneurs, and tech transfer leaders on the issues and trends that matter most. Keep listening for an inside track on the people, IP policies, and politics changing our world.
Welcome to Autumn on the Air. In today's episode, we're exploring the journey from university lab to real-world impact and what it takes for early-stage startups to cross that gap successfully. If you've ever wondered why some technologies make it out of the lab and others don't, or what separates a promising research project from a fundable, investable startup, today's conversation is for you. My guest is Marc Filerman, Chief Business Officer at Start2 Group, Inc., a global accelerator that funds, de-risks, and internationalizes promising early-stage startups across all sectors. Marc is a serial startup founder and angel investor with deep expertise in the translation and early commercialization of medtech and health tech ventures. He co-founded two startups, a molecular imaging company and an NIH-funded home tech company. Before that, he held corporate leadership roles, including VP of Global Marketing at iCAD and Group Director of Marketing at Smith & Nephew, where he built a 30 million operating room integration business from the ground up. Marc holds MS and BS engineering degrees from MIT. At Start2 Group, Marc works at the intersection of academia, startups, and government, helping run programs like VITAL, a BARDA accelerator network hub supporting biotech and health security innovation, and Stride Ventures, an NSF accelerator hub advancing deep tech commercialization. With over 6,000 companies supported, 12 unicorns, and more than $17 billion in funding raised across Start2's programs, he has a front row seat to what makes startups succeed and what holds them back. Marc, welcome to Autumn on the Air. So excited to have you on the podcast today.
Thank you so much, Lisa. It's my pleasure to be here. Thanks for having me.
Well, I thought, Marc, the best place to start the podcast today is with this absolutely fascinating career arc that you've had, from MIT engineering to corporate leadership at Smith & Nephew and iCAD to co-founding your own startups. And now you're working with hundreds of early-stage ventures at Start2 Group. So talk to us a little bit about what the through line is that connects all of these different experiences for you, and ultimately, what drew you to the work of helping startups de-risk and grow?
Well, that is an interesting question, actually, because there are through lines, I guess, things that have really guided my career and the choices that I've made throughout my journey. And I would say there are three of them. First and foremost, I like building things. I, as you said, was an engineer, a practicing engineer for many years, and I attribute my mechanical engineering skills to the fact that I broke a whole bunch of things in the apartment where I grew up in New York City, and had a deadline of my mom coming home from work, so I had to learn to fix things, and that translated necessarily or grew to building things from scratch. So I enjoy that process tremendously. And that has expanded from building things, widgets, to like building companies and helping people grow. So that's the first thing. Second thing is I like working with complexity and solving complex problems. That is brings me intellectual stimulation, right? To figure something out, to figure out where the opportunities are, and then to create things to address them. And so in a way, it's 1 and 2. This building things and complex things are inextricably linked for me. But I would have to say that the overriding and overarching umbrella that has really guided me from a very young age is the fact that I love teaching and enabling others. When I learn something, it's like all I can do to contain it within me. I'd much rather tell everybody like, oh, I learned this really cool thing, and share that. And it's actually through that process that my understanding of whatever it is that we're learning at the moment becomes deeper. So that the process of having to develop frameworks to convey information in reasonable or understandable ways helps me solidify that understanding for myself. So those 3 things: building things, working with complexity, and solving complex problems, and then teaching about that would have to be the 3 through lines that have enabled the journey.
Now, as you said, you were an engineer. How did you get out of engineering into startups and venture funding and becoming a serial investor? Because that in and of itself, just given your background and what you just described, must be an interesting story as well.
Yeah. So, well, it actually started. So I came out of graduate school. I started as an engineer. I was designing ultrasound imaging equipment for echocardiography, which was fascinating. I absolutely love medical imaging. But 2 things happened around 5 years in that were transformational for my trajectory. The first is that I looked around at my manager and the manager above him, and I thought to myself, wow, I really don't want to do either of those jobs. So I looked at that and I thought, well, so I'm like, what track am I on here? And where do I really where's this going to take me? But the second thing, which was arguably more important, is that I realized that my passion lay in figuring out the problem and then guiding the solution, the development of the solution, whether I did that or provided the information to help others develop the solution. But that being in between of really working with customers, so clinicians, cardiologists, cardiac surgeons, initially, was where and then translating what they have described in terms of clinical problems into engineering specifications. So doing that translation was something that I really was passionate about. And so that took me from R&D to make that big leap into what's called upstream marketing. So the branch of marketing that sits right between the customer and the R&D team, the science team, the engineering team, the software teams that develop things. And to tell you God's honest truth, I have been effectively doing that fundamental work since 1995, 1996. And that has been, I guess, another common through line, which is very coincident with complexity, with building things, and with teaching. But the building part is informed by having a deep understanding of the problem. because it enables you to develop the right things. So things that I learned as a product manager, I have carried with me and used to guide the development of the 2 startups that I've helped co-found, and as a real litmus test as an investor, to probe on the depth of understanding that startups that I interact with actually have.
Well, and I think that's a great segue to start talking about Start2 Group, given your career arc. And let's just talk a little bit about the basics about it. You know, for our listeners who might not be familiar with it, can you give us a picture of the organization? Because I know you're active in 21 countries, you have 17 offices, so you have this really big global footprint. How do you describe what Start2 does and how it differs from our traditional thinking about accelerators or incubators?
Yep. So Start2 Group, as I'm fond of saying, is like the best kept secret in Kendall Square. And I say that really to cast aspersions on myself, because what we do is pretty unique and is totally cool, and I'm deeply passionate about it. And it's my fault that people don't know more about us. So I'm endeavoring to change that every day. But Start2 Group, the Inc., so the U.S. Daughter child of actually a German topco, exists. And my colleagues will laugh at me if they hear me talking now. Because I'm fond of saying that Start2 exists to help startups and academic projects de-risk, grow, and scale. So all we do is to help these startups really understand the best ways for their projects to launch as entities, and for those entities that are already formed to define a path for success. And interestingly enough, this ties very much back to one of the points that I was talking about to answer the question about my career trajectory, because having a deep understanding of the problem is central to that. So Start2, as you say, we've got 17 offices in 21 countries. We first started with a big contract from the German Federal Ministry for Economic Affairs to help German startups in deep tech and health tech and SaaS and actually sector agnostic internationalize. So all of these offices were initially created to be destinations for German startups. Well, what has happened very sort of quickly with the entrepreneurially oriented people that work in these offices is that other programs have developed from that. So now we have programmatic vectors with dual, the bi-directional, so heads on either side, a tail in one country, a head in another, so a source and a destination. The United States is clearly a large destination for startups from Latin America. So we have offices in Sao Paulo in Brazil, Buenos Aires in Argentina, Singapore, Japan, South Korea, India, China, and obviously in Germany and Europe. So I look after the life science programs and the deep tech programs, really for the U.S. being a destination and for U.S. government programs. So we have a large number of U.S. government programs, specifically with BARDA, the Biomedical Advanced Research and Development Authority. It's part of Health and Human Services, where we manage, hundreds of millions of dollars for them, with them, in non-dilutive funding that we award and contract and tranche to sub-awardees, so innovators and startups in the States. And we do a very similar thing for the National Science Foundation. So we've got internationalization programs, to support startups, really, and then a bunch of funding and development and translationally oriented programs that come with non-dilutive funding and mentorship-based scaffolding around that money, and that's actually a core of what we do is mentorship-based de-risking. We do that in a very individualized way, a very startup or academic project-centric way. We've got lead mentors that are matched with these companies. So it's a very individualized, somewhat boutique-y, very high-touch set of programs to help academic projects and startups de-risk, grow, and scale.
Now, sticking with these government-backed programs, you work a lot with VITAL, which is with BARDA, and Stride Ventures for NSF. Are there particular kinds of startups or academic projects that are a best fit for VITAL versus Stride Ventures?
Yes, absolutely. So VITAL is a brand name, a collection of programs that, as you said, we Start2 does with BARDA. These have commonalities, all of these programs. So VITAL is very specifically focused on biotech. So it's biotech only. And it's biotech with indications or applications that are in infectious diseases or what's referred to as seaborne threats, chemical, biological, radiological, and nuclear threats. And the reason for that is BARDA is solely focused on the development of medical countermeasures. Basically, BARDA exists for pandemic preparedness, pandemic response, health security in general, in the United States and more broadly. So all of the now 5 programs that we run through VITAL are all focused on variations or specific sets of science under that umbrella. Stride Ventures is similar in nature, or that name, Stride Ventures, is analogous to VITAL in the sense that it's another collection of programs that Start2 does, but this time with the National Science Foundation. Stride Ventures has, at this point, nothing to do with healthcare, health tech, biotech, medtech, none of that. The program that we are currently running through Stride Ventures is focused on the deep tech area of rare earth element and precious metal reclamation, so reclaiming from e-waste and mineral waste streams. So those two, the Stride Ventures programs and VITAL programs are analogous in the sense that they both come with money, they both come with mentorship, scaffolding, and they're both funded by U.S. government authorities, U.S. government agencies. But the foci, the tech foci, the scientific focus areas are totally different. So if I can take a moment to make a shameless plug for any innovators that are out there, and this is arguably relevant for many of the Autumn members, we have a solicitation open right now through VITAL that is focused on the development of small molecule, broad spectrum antivirals. So this program is called the Smart Antiviral Prize, and it is an unbelievably large effort. So over 5 years, we are going to be awarding over $100 million or $100 million and likely over. So it's $100 million effort towards the development of antivirals, specifically broad spectrum, small molecule, and more specifically for antivirals for dengue, for Zika, for chikungunya, and the like. So that is available at vitalhubhealth.com or smartantiviral.com. And for all innovators in the antiviral space, there is money available. So please apply.
How long is the application period open for that?
So it opened February 2nd, and it will close May 11th. After which we will do a series of evaluations, and ultimately we will select a small number, like 8 sub-awardees, to get multi-millions of dollars for a concept stage, and that would move. So Smart Antiviral is a staged competition where there will be increasing dollar amounts to a smaller and smaller number of sub-awardees as their tech, their science is de-risked over the years. So as we go from concept of an antiviral through hit to lead and lead all the way to IND readiness in 5 years.
Wow, that's an ambitious project, but one that's very much needed. So thank you for sharing that information.
Of course.
And Marc, you've worked with a tremendous number of startups across your entire career. In your experience, what are some of the key fundamentals that separate some of the startups that succeed from those that don't? You must see some patterns that happen over and over again.
Yes. Fortunately or unfortunately, I do. And it is alarming. It's like one of these things where you wish somehow that knowledge could be passed on genetically, right? We as humans get certain things that we just sort of do instinctually, and then we have to learn a whole bunch of things. Startups is certainly one of those things that's learned, and there's a dual message here. The good news and the bad news is that there are patterns. But I guess the good news is that there are certain things that are absolutely, positively learnable that can significantly affect the probability of success. Startups, particularly in the life sciences, fail for a large number of reasons, shall we say. But I have 3 recommendations that I'll talk about that I would very much encourage Autumn members, so anybody working in a tech transfer office or related, to encourage these founders or leaders of academic projects to focus in on. The first is a drum that I've already beat multiple times in this conversation, and that is to have very clear, well-defined problem statements. And it is alarming and surprising in a way that even though so many startups start up, because of a tech push idea that the founder thinks could be applied to some problem. The specificity of that problem and the depth to which the founders understand that problem is typically not enough for them to accurately convey what they're trying to do in a clear, well-defined way and package that in a convincing umbrella to get funding, to get customers, to get non-dilutive funding, so to get investment, to get non-dilutive funding, because they don't understand their problems well enough, or the problem that they are trying to solve. And this is so critically important because, particularly for investors, if the investor doesn't understand the problem or doesn't think that that problem is worthwhile, they are not going to invest in that company, right? If the founder puts so much of the work onto the investor or to the reviewer in a non-dilutive funding case to really try to make heads or tails of the problem, that's too high of an activation energy and they're going to get rejected. Also, and related, without a well-defined, clear problem statement, the value proposition is not as well understood as it could be. So value proposition and having a clear, strong value proposition is the second area that I see startup founders really not articulating well. And partially that stems from the fact that they don't really know what problem they're solving. So they list features in the worst case, benefits in the best case, that are not tied to the problem that they have framed for the listener, whether that listener is a customer, an investor, or a partner. And that lack of continuity, that lack of direct association is incredibly problematic for multiple reasons. One of which is that it demonstrates very clearly that they kind of don't really know what exactly they're doing, which makes investors very hesitant for them to give money to individuals that are essentially unsure of what they're going to do with it or unable to articulate what they're going to do with it. So the problem statement has to tie directly to the value proposition. And value propositions are these things that are so easy to understand in concept, but in practice are alarmingly difficult to articulate and to validate, similar to the problem statement. Very easy to conceptually understand, but typically hard to specify. So in the problem statement, we confuse context in these general statements with a specific problem statement, which is problematic. And then on the value proposition side, startup founders typically think that value propositions are benefits. Oh, I've got this benefit. I do this, this, and this, and this. I provide these clinical benefits. I provide these economic benefits. I provide these workflow benefits. Bob's your uncle. It's all good. But what they fail to understand at depth or in their heart is that value propositions inherently are not benefits. And by definition, in fact, in my little world, value propositions are the ratio of these benefits to all of the reasons why nobody would ever adopt their kit, right? That integration, that sum of the adoption hurdles that prevent or make more complex the sales process and the realization of the benefits in the numerator. So value propositions are benefits in the numerator divided by adoption hurdles in the denominator. And that ratio is got to be a lot higher than one in order for people to buy your kit. And so I actively encourage founders to think, is the juice worth the squeeze? Is the view worth the climb? And that's frustrating for some founders because they say things like, well, customers should really want to improve efficiency. Clinicians should want to improve patient care, and hospitals should want to reduce costs and improve clinical care in general. Well, duh. Yes, of course they do. But that's not the point. The point is, at what cost? What has to change in clinical workflow? Who do they have to hire? Who do they have to fire? What integration, either from a system standpoint or an IT standpoint, or a process standpoint, do they need to do to realize the stated and maybe even agreed upon benefits that solution provides? So it's always this ratio, and founders are very good. Speaking as a serial founder, I've made this mistake before. We are so good at focusing on the numerator, on the benefits, and minimizing or forgetting about or not understanding or not realizing all of the adoption hurdles that instantaneously erode the value proposition and consequently the ability for customers to realize the benefits of a solution. So clear problem statement tied directly to a clear value proposition where the adoption barriers are well understood and addressed. And then finally, I would have to say, and sorry for babbling here, that embodying both those concepts into a strong foothold market is critical. So focus over FOMO is another message that I'd like to give to founders. Focus, 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 focus. You can always build, but you have to have a well-defined foothold from which to ascend. And this can be very problematic for founders that believe they're working on a platform. Oh, I've got a platform, man, that can do this, it can do that, we can use it here, we can use it there. And that's great. But if you don't start someplace, or you don't give your investor, your partner, your customer a deep understanding of how that growth happens, how that walk happens, how that company will grow as it solves a specific problem and then adjacent problems in potentially larger markets, their credibility goes down. That founder's credibility goes down because in the minds of the listener, they're looking for the gold, not the mine. If the mine, in other words, the platform, doesn't produce gold, in other words, solutions to specific problems and specific indications or applications, then the mine, the platform, is not worth anything, despite the fact that it came out of Professor Dr. So-and-so's lab in wherever. So clear, well-defined problem tied to a strong value proposition with a clearly defined foothold market. I would say these are the three messages that just come up all of the time.
Those are really great. And I want to stick with them for a few more minutes here, starting with the well-defined problem statement, because one of the things you said was that conceptually it's very easy to understand what that means, but it seems to somehow get lost in practice. So given that, for our listeners, could you give some examples of what a strong problem statement actually looks like?
Sure. So there is an example. So I was working with a company that was developing a solution for pancreatic cancer. And I thought that they had a beautifully framed problem statement, okay, that had two points, two areas. They had a contextual statement that was broad enough and compelling enough to convey at a high level that the problem was high in severity and high in frequency. And then they provided specific problems that highlighted the consequences of not solving that problem and the fact that current solutions to that problem were poor. So it went a little something like this. Pancreatic cancer is the fourth most common cause of cancer death. So great contextual statement. It establishes, wow, this is the fourth most common case of cancer, and the fact that the consequences are death. So very high severity and high frequency, fourth most common. But then they supported that contextual statement with the following two statements. 5-year survival rate is less than 10% because the diagnosis happens at an advanced stage, and the symptoms or that patients are rarely symptomatic at the early stages. And second, that the current solutions, the current resection therapies, were possible only in a small number of cases, and that combination of resection, surgery, and chemotherapy had significant side effects. So underneath the umbrella of fourth most common cause of cancer, death, they really set up the fact that the current problems were poor, that current resection therapies were possible in a small number of cases, and that this combination of surgery and chemotherapy was problematic for patients. So that was a very nice framing of a problem statement that then set up their description of their value proposition very, very nicely.
Now, speaking of value proposition, you said value proposition is not benefits. You frame it as benefits on the numerator divided by adoption hurdles as the denominator. So given that, what are some of the most common adoption hurdles that founders tend to underestimate?
Great question. So I would answer that by saying that the first one that they, so there are two that sort of related. So the first, by far, I would have to say, is that founders underestimate inertia. Just doing something different is complex and hard. And this is particularly true in the hospital setting, critical care settings, even in surgery center or primary care settings where there's a little bit less complexity potentially, but where there are many moving parts. So the more people, departments, and processes that are involved in the adoption of anything new increases the inertia. And so even if the benefits are there, they can be quickly drowned out by the fact that multiple departments within a hospital have to agree, even though they have different budgets. That a big one is that IT has to get involved, and the systems integration is problematic. And it's even down to like, look, I as customer would love to adopt your solution, but I have an 18-month queue in our IT department because of other initiatives. And the problem that you are solving does not warrant me hiring somebody else. So I can live with the problem. This is another thing about inertia. I can live with the problem. So this is, if you ask me in the absolute, me as a customer, you as a founder, if you ask me, is this a problem? I will nod emphatically. Yes, that is a problem. But it is a problem that is 12 on my priority list of 5. So I'm never going to solve it until I get through those 5 and the other 5, 6, 7 other problems to get to 12. And maybe I don't actually solve those 5 and they persist. So this underestimation of inertia, this solving of problems that are not actually high enough problems to be actionable by the customer, are 2 of the biggest problems. And related and ubiquitous to both of those things, particularly in healthcare, is this IT integration, right? Because particularly for situations where the solution has some sort of IT component or some app, if it doesn't integrate with the current systems or it doesn't integrate with the current workflow, that is a huge obstacle to adoption.
Now, you also emphasize the importance of a clear foothold market, what you called focus over FOMO. How should academic founders think about picking that first application or first market? And why is that so incredibly hard sometimes to narrow down?
Okay, let me answer the second part first, if I may. It's so hard because it's so scary, because particularly academic founders view it as so limiting. I've pumped out 12 PhDs working on this platform. It has all of these applications. How dare you insinuate that it only has applications in a small number of indications or use cases or applications. And like, sometimes it is true that there really are broad applications and that this platform could have it could provide solutions in multiple arenas. But it's so scary for the academic founder in particular to frame all of that great work with so many potential applications so narrowly in a foothold market. So there's some intellectual resistance to doing that. And what they fail to realize is that it's not zero sum. It's not an either or. In fact, it helps the credibility of the platform. It helps the credibility of the founder to be able to articulate clearly this foothold market. What that also enables is a very credible growth walk. Because if you segment your customers based upon the problems that you are solving for them and the indications or applications of that platform lead the listener, the investor, the partner, the customer on a walk that clearly defines how you intend to grow your company and what problems you intend to solve with your platform. So it's a great thing and a necessary thing for founders to be able to articulate their foothold market. And the foothold market, just so everyone's on the same page here, and I think this may be the answer to the first part of your question, the foothold market is a market where the adoption of that particular technology is insanely small, where like that customer is calling you, begging for your solution, and where they will swim and crawl through, muddy water with broken glass to get at your solution. That's the type of foothold market that you want, where that adoption to benefits ratio, i.e. the value proposition, is significantly large.
So, Marc, I'm curious from where you sit, having seen the full landscape of accelerators, government programs, and private investment, what do you think is the biggest gap or maybe missed opportunity in how universities currently approach commercialization and startup support?
Okay, this is really important, and thank you for asking this. So building successful companies is hard, right? And solving important problems is great. Like, this is a worthwhile goal that we should all be focused on, full stop. But I do think there is an opportunity for tech transfer professionals to work with these academic founders to really help them embrace the importance of validation earlier on, basically more broadly, to adopt a commercial lens as early as possible to get these founders accustomed to answering the questions that they will be facing very soon after they spin out their company, or even increasingly so while they're still in the hallowed halls of academia. So the importance of IP is large, right? IP is the protectable asset that any acquisition or license is based upon. But there is a set of orthogonality in terms of programmatic support that I think ultimately improves the success rate of those entities, improves the value of the M&A activity and the license activity. And so tech transfer people are in this great spot because they see all of these opportunities way before everybody else. And so sort of beating the drum of that commercial lens, independent of the IP, I think is very important. And I know that costs money and it costs time and potentially is a different skill set of people in the offices, but it's very important. And kind of related to this, preparation that tech transfer offices can do for academic founders is to help them differentiate the types of funding that are available. It's it's fun and sexy to kind of think about going to talk to VCs. But VCs, they have a very well-defined model, and it's very narrow. And if you don't fall into that, if you don't meet that criteria, if you don't align, then you're out. And there are many valuable things in the world that are coming out of academia that are not aligned with a VC model. So angels and family offices and, God forbid, bootstrapping are incredibly valuable tools to enable growth that can be highlighted by tech transfer people at the very early stages, so that these founders don't just think VC, VC, VC.
Well, Marc, this has been a very fascinating and insightful conversation. Thank you so much for joining us on the podcast today.
The pleasure has been absolutely mine. Thank you for giving me a little soapbox to reinforce some of the messages that I deal with a lot on a daily basis. So thank you. This has been great. Hopefully I cured insomnia for some people listening to this. I'm sure they would have much rather have heard you talk than me, but hopefully it was useful in some way.
I don't know about that, Marc, but thank you so much again for being on the podcast today.
The pleasure is mine.
Marc, thank you so much for joining us today on Autumn on the Air. This has been an incredibly insightful conversation. You've given us a clear framework for thinking about what makes startups succeed, from defining the right problem to building a true value proposition to focusing on a foothold market to making the case as an investment, not just a business. And you've shown us how programs like Vital and Stride Ventures are helping bridge that critical gap between academic discovery and real-world impact. For our listeners, we'll include links in the show notes to learn more about Start2 Group, the Vital and Stride Ventures program, and how you can connect your institutions and your entrepreneurs with these resources. If you found today's episode valuable, please share it with your colleagues and your faculty innovators. These are exactly the kinds of insights that can make a difference early in the commercialization journey. Thanks for listening to Autumn on the Air, and we'll see you again next week.
Thanks for listening to Autumn on the Air with Lisa Mueller. Get social with us and share your thoughts. You can tweet us at AUTM or visit us online at autm.net. We'll be back next week on the air. Be sure to join us.